Hi, on this video I will teach you how to recommend different types of diets to patients with different conditions. One thing that doesn't change is that the patient has to drink the amount of water balanced with the amount of kilograms the patient has. So he has to drink 35 milliliters of water for every kilogram he has. So a patient with 74 kilograms has to drink 2 liters 590 milliliters of water. So that doesn't matter which diet he takes, NPO, diabetic diet, low sodium, low fat, it always has to be that follow the rule of amount of water. And how much is going to be distributed is during the day and never during night, because the patient is going to be sleeping. In case of this patient, the patient has heart and blood vessels problems. So I would recommend a low-fat diet, which takes high amounts of protein and carbohydrates. The other food is baked, boiled, or roasted, so it can solve the problems of the patients. In this case, the patient had esophageal infection, so I would recommend an NPO diet through gastrostomy or an IV. Okay. The patient had a surgery in the intestine, so I would recommend a full liquid diet, which is a temporary diet, and the patient has to be fed 6 to 8 ounces every 2 or 3 hours. I would choose this diet because it do not irritate the body and don't cause gas or encourage bowel movement. This patient is diabetic, so I would suggest a diabetic diet, which is a balanced meal, and we always have to keep attention to the appetite and food intake of the patient.